Hello, this is Dr. Gay from First Lake MRI, and this is a 34-year-old female who has a 2 or 3 month history of nystagmus, diplopia or double vision, and also vertigo. She went to her doctor and they thought maybe she had multiple sclerosis based on the clinical symptoms, or maybe even a tumor, and she had an MRI performed to see if there was evidence of multiple sclerosis or a brain tumor. And as we get down here, this is the cerebrum up high. We see darkness here, this fluid in the ventricles. As we go down low, we see she does have a significant abnormality in her midbrain here, down below the cerebrum. And this is getting down into the pons and medulla, so parts of the brainstem. So this lesion is in the midbrain, and then also the brainstem. This expansile is enlarged and growing backwards a little bit into this area called the fourth ventricle. But the ventricles fill with fluid here. These are not dilated, so it's not obstructing that fourth ventricle. So a mildly expansile, diffusely infiltrator process. And the question is, what is this? Is this tumor or infection or multiple sclerosis? And the truth is we cannot tell. This is a sagittal view here. We see the lesion in the midbrain here, back of the pons. This is the pons. This is the medulla, so it comes down along the back of the pons into the back of the medulla. And this could be related to a tumor, like a glioma, a slow-growing tumor of the brainstem. And tumefactive multiple sclerosis also could produce an infiltrator process like this. It did not enhance. Neither of those has to enhance. And another thing that could cause this is acute disseminated encephalomyelitis. So her prior illness she had, a viral or bacterial illness, could cause a response called acute disseminated encephalomyelitis, where they get demyelination, very similar to multiple sclerosis. It could look just like this as well. So the question is, which is it? She did have a CSF analysis that went in and drew fluid off of her spine, did a spinal tap, and they saw that she had increase in lymphocytes, and those can be associated with acute disseminated encephalomyelitis, but apparently not diagnostic. She's supposed to go for some other tests, but reading about this, they can be really hard to diagnose and really hard to treat these lesions. She did get steroid therapy, and her steroid therapy did not seem to affect her one way or the other, did not make her symptoms resolve or improve at all. And so now they are at holding pattern trying to get a definitive diagnosis and figure out what to do as far as treatment goes. She's going to get to MRI spectroscopy, where they'll do an analysis of the tumor or the infectious process or the inflammatory process or demyelinating process, whatever this turns out to be, and they can analyze that, and if there's a certain spike that may lean towards or give high confidence it's a brainstem glioma rather than the other things. But she's set up for that. So when I finally get to talk to her again, I'll do another video and when I learn some more. Hopefully this is acute disseminated encephalomyelitis rather than a glioma, and given these sharply defined margins and rounded appearance here, it leans towards that. Also with those elevated lymphocytes in the CSF, it leans towards that, but again, at this point we don't know for sure. And thank you very much.